when do you run out? So, unfortunately, we do cure some cancers. Um, we continue to try to devise new drugs, and the current philosophy is looking at genetic mechanisms in many diseases. So you try one, let's say you have, five uh, holes in your garden and you want to fill them up. So you try the first hole, you try drug A in the first hole, that it didn't work. You go to the second hole, you try a different drug. And that's what we do. We look at different genetic mutations. We may devise a drug for the first one. If that doesn't work, we may do it for the second one. And if that doesn't work, or sometimes we'll take both of them together and see if we can get them to work. So it's really, it doesn't sound like a very exact science, and that's the way drugs get developed, though. Sometimes we're using our best judgment to try to make things work, and sometimes we're just lucky. Sometimes we're not. Just like I said, the drug that shoots photons through the shields in the spaceships doesn't work in myeloma. We didn't know that wasn't going to work. Yeah, so they may take a standard drug and give you the new drug and see what happens with it.
This is a heavy weight. I think, yeah, can I pass a question on to him? I think that is true actually right now, but based upon the research that they are doing with the Compass trial, right? I think the way these guys are growing they're finding so much information that there is a very good possibility that we'll find that missing link. Yeah, it's just about knowing, what do we know so far? It's not the question of being there or not.
So it's a great question. What about family trees of similar diseases? So in myeloma, at this point in time, there is no known gene that's inherited that says you're going to get myeloma. It's a little bit different. People talk about familial diseases. The one that's most commonly talked about is breast cancer. That there's this gene called BRCA. That is, if one member of the family has BRCA, there's 20%, something like that, likelihood that someone else will get breast cancer. There's no gene in myeloma that we know gets passed down from generation to generation. That being said, there's a small risk, very small risk, that if one person in the family has myeloma, that another person will have. But we don't generally screen family members because the risk is so extraordinarily low. We're in my practice in Hackensack, we've got a guy who's looking at gene mutations in families. He's doing it with blood and bone marrow to see if we can, and this isn't the first time, but to see if we can actually find some linkage of why there are these very small clusters of families that have more than one person with the disease.
And also, I will add, not about multiple myeloma in general, but just to say that until we, as a community, as people of color, really participate in many studies, we will never know the real answer. Doris? Well, environment is related to many diseases, and cancer is one of the ones that's most impacted by the environment. I don't know if any studies are out, but we'll see.
Yeah, so no studies because that's very tough to check. But again, if multiple members of the family and have a particular type of lymphoma or sometimes leukemia or myeloma, then comes the question: is it because they lived in that particular home, and they got the water from that particular river and that environment? So I think there will, again, Agent Orange we know, for example. So there's some environmental thing with these bone marrow conditions. So more than like a genetic thing like the BRCA.
In myeloma, the government, or our government, for better or worse, recognizes two associations with sort of the environment and myeloma, cause and effect. One is Vietnam veterans exposed to Agent Orange has a slightly increased risk of getting myeloma, and the rescue people after 9/11 have a slightly increased risk of getting myeloma compared to the population, so the government actually recognizes those two entities, if they're environmental exposures that are associated with myeloma.
She's talking about tumors in your body, all over your body, and in your brain. Did somebody mention tumors in the brain? Oh, no.
So in general, myeloma is a bone marrow disease. However, some patients do present with masses of myeloma that we call plasmacytomas, and they could be anywhere in the body. Brain would be very unusual; doesn't usually go to the brain, and to have in specific organs would be unusual. Have I ever seen somebody with a breast mass who had myeloma? And the answer is yes, but they're really not very common. In general, myeloma stays in the bone marrow, doesn't form tumors. Donating your bone marrow to have donor transplants. Donor transplants are commonly performed for leukemias, some pre-leukemic conditions called myelodysplasia, and for some forms of lymphoma. They are sometimes performed in myeloma, but pretty rarely. They're still investigational. I told this other gentleman that all insurance pay for transplants using your own cells. It's not the case doing donor transplants in myeloma. It's considered to be investigational or experimental. And yes, there's some centers that do them, but there's not very many. For example, there are somewhere upwards of about 9,000 transplants for myeloma using your own cells a year in the U.S., but there's only about 200 donor transplants for myeloma yearly in the U.S., so it's like 9,000 to 200, but they are performed at some select centers.
We're going to have to do this as a sidebar because Pat has told me to wrap up. So I want to thank you all for this session and thank the speakers for contributing to a valuable conversation about clinical trials.
Let's give them all a hand. Dr. Campbell, Dr. Meir, Dr. P, Dr. Vassell, give them all a hand.
Okay, a little housekeeping here.
Okay, a little
First of
housekeeping
all,
here.
We have a gentleman in the
First
back.
of all, we have a gentleman in the back who is a multiple myeloma
You've got
patient as well.
60 seconds.
You've got
because
60
we stopped a minute
seconds
earlier.
because we stopped a minute
So if you
earlier.
could stand.
So if you could
We
stand.
remember that the doctor said more
We remember
men
that the doctor
have
said
multiple
more
myeloma
men
than
have
women.
multiple myeloma
So you can come to
than
the
women.
front. I'm
So
gonna
you
get
can
my
come to the
hook
front.
after 60
I'm going to
seconds
get
'cause
my
we got a
hook
lot of
after
stuff to
60
do.
seconds.